The prayer this morning will be offered by the good gentleman from Baltimore County.
Thank you, Madam Speaker. If we all could bow our heads. Dear Heavenly Father, we just come before you today, Lord, and we just ask for your guidance and your wisdom to do the people's business down here. We also need to pray for our leaders in Washington, D.C., and in Russia, and all over this world. We live in some troubled times, and we need your guidance and wisdom at this time. We need peace. We all need peace. Amen.
Quorum call.
Madam Speaker.
The clerk will call the roll. There being 124 members present, the House is now in session. The clerk will read the journal from the previous day.
Annapolis Mail on February 24, 2022.
Recognizing the Deputy Majority Leader.
Thank you, Madam Speaker. So much be considered the reading of the journal.
So ordered. Petitions, memorials, and other papers. Clerk will read the bond initiatives and the committee assignments.
Introductory House Bond Initiatives number 40, February 25, 2022, referred to Appropriations.
Message from the Senate, consent calendar number 13, Senate bills introduced in the House. Clerk will read the first bill and committee assignment.
Senate Bill 79, Senator Bailey, Ways and Means.
Recognizing the Majority Leader.
Thank you, Madam Speaker. I move that the reading of Senate Bill 79 be considered the reading of all the bills on the calendar.
Hearing no objections, the bills are read the first time and referred to the appropriate committees. Report of the Committee on Appropriations, report number 2. Clerk will read the first bill.
House Bill 54, Higher Education, St. Mary's College of Maryland, Cost of Living Adjustment, favorable.
Question before the House is the adoption of the favorable report. All in favor? I can't hear. Okay. Thank you. Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read next bill.
House Bill 444, Maryland Senator Edgar J. Casemeyer College Investment Plan, State Matching Contribution, Age of Account Holder, favorable.
Question for the House is adoption of the favorable report. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read next bill.
House Bill 447, Human Services Cash Campaign Annual Appropriation, favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any amendments to the bill or to its title?
Madam Speaker. Sorry.
Recognizing the gentleman from Culver.
Sure. Madam Speaker, I just wanted to see if I could special order this bill from the floor leader. Just had a few questions that I wanted to get answered about what they do, if that's possible.
Recognizing Subcommittee Chair.
Thank you, Madam Speaker. No problem on the special order. Thank you.
Thank you. I appreciate that. Madam Speaker, move a special order this bill to the appropriate time tomorrow, if I may.
Question for the House is the special order HB 447 to the appropriate time tomorrow. All in favor signify by saying aye. Opposed, no. The ayes have it. Bill has been special ordered. Report of the Committee on Appropriations, report number 3. Clerk will read the first bill.
House Bill 90, State Personnel Management System, Office of the Public Defender, Placement and Collective Bargaining, favorable amendments. Amendment number 1.
Madam Speaker.
Recognizing the Subcommittee Chair.
Thank you, Madam Speaker. So much be considered the reading of the amendment.
So ordered.
The amendment is technical and corrects drafting omissions. Move the amendment.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 379, State Employee and Retiree Health and Welfare Benefits Program, eligibility for enrollment and participation, Independent Agency Health Insurance Option Act. Favorable amendments. Amendment number 1.
Madam Speaker.
Recognize the subcommittee chair.
Thank you, Madam Speaker. So much to be considered the reading of the amendments.
So ordered.
The amendment provides DBM with 60 days instead of 30 days to determine whether Marbitco, MCEC, and Bain Bridge Development Corporation are eligible to enroll the percentage, and participate in the State Employee Retiree Health and Welfare Benefits Program. Move the amendment.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill as to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 742, State Retirement and Pension System, COVID-19 related death benefits, sunset extension. Favorable amendments. Amendment number 1.
Madam Speaker.
Recognizing the floor leader.
Thank you, Madam Speaker. So much to be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment number 2 adds dates to the body of the bill to make it consistent with the 1-year extension. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 743, Teachers Retirement and Pension Systems, reemployment. Favorable amendments. Amendment number 1.
Recognizing floor leader.
Thank you, Madam Speaker. So much to be considered the reading of the amendments.
So ordered.
The amendment establishes a cap of 25 retirees that can be hired under the bill. Move the amendment.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 744, State Retirement and Pension System, Administration, Clarifications and Corrections. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. So much to be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment 2 addresses 2 specific situations where the board is required to accept service credit earned in the employee's retirement or pension system for 2 individuals who have applied for disability but did not have the required 5 years of service credit under the correctional officer's retirement system. The provisions are carefully drafted to address just these 2 individuals specifically. Move the bill. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Report of the Committee on Health and Government Operations, report number 3. Clerk will read the first bill.
House Bill 48, Public Health, Maryland Suicide Fatality Review Committee. Favorable.
Question for the House is the adoption of the favorable report. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read the next bill.
House Bill 49, Public Health, Emergency and Allergy Treatment Program, Nurse Practitioners. Favorable amendments. Amendment number 1.
Madam Speaker,
Recognizing the Vice Chair of the Committee.
thank you. Good morning.
Good morning.
Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 adds sponsors and makes technical changes. Amendment number 2 clarifies that the bill applies to registered nurse practitioners and clarifies that the immunity provisions extend to the prescribing of auto-injectable epinephrine. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read next bill.
House of 260, State Board of Physicians dispensing permits. Favor the amendments. Amendment number 1.
Madam Speaker.
Hold on one second. Gentlemen, what?
Thank you, Madam Speaker. I just wanted to note the floor system appears to be down for this side of the chamber.
See back there. Okay. Okay. House Bill 260. Floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment number 2 transfers funding and records related to inspecting the offices of physicians who hold dispensing permits from OCSA to the Board of Physicians. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill as to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read the next bill.
House of 373, State Postmortem Examiners Commission minimum staffing requirements. Favor the amendments. Amendment number 1.
Recognizing Vice Chair of the Committee.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 adds sponsors and makes technical changes. Amendment number 2 clarifies that the Maryland Department of Health is responsible for ensuring adequate levels of staffing for the Office of the Chief Medical Examiner. Move the amendments, Madam Speaker.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. Amendments are adopted. The question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill as to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 375, Open Meetings Act, Application and Enhanced Requirements, Maryland State Agency Transparency Act of 2022. Favor of amendments. Amendment number 1.
Recognizing floor leader.
Move so much be considered the reading amendments.
So ordered.
Amendment number 1 is technical and adds co-sponsors. Amendment number 2 does the following. Establishes that project site visits and educational field tours are not meetings subject to the Open Meetings Act for the entities covered in this bill. Strikes provisions that would have included the Board of Trustees of the Maryland Automobile Insurance Fund in the bill. Clarifies the documents that a public body must make available on its website. Repeals language related to the open meetings requirements of the Maryland Environmental Service, which are covered elsewhere in the bill. And Amendment number 3 establishes the intent of the General Assembly that the requirement to post certain materials may not be construed to limit discussions or deliberations to matters referenced in those materials. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted.
Madam Speaker.
I see you. I have to go through this first, okay? Gentleman from Harvard.
Thank you, Madam Speaker. I would like to request that we special order this bill to the appropriate time tomorrow for possible amendments.
Floor leader.
Committee has no objection. We just request that you give us the courtesy of showing us the amendment once you have it.
Absolutely.
Thank you.
Question for the House is to special order HB 375 to the appropriate time tomorrow. All in favor signify by saying aye. Opposed, no. The ayes have it. The bill has been special ordered. Clerk, read the next bill.
House Bill 430, Human Services, Secretary of Aging Qualifications. Favor of amendments. Amendment number 1.
Recognizing the Vice Chair of the Committee.
Thank you, Madam Speaker. Move so much be considered the reading of the amendment.
So ordered.
Thank you. Amendment number 1 adds sponsors and strikes the requirement that the individual appointed as the Secretary of Aging have a bachelor's degree. Move the amendment.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 536, Maryland Insurance Commissioner Authority, Federal Health Emergency. Favor of amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the readings of the amendments.
So ordered.
Amendment number 1 makes technical changes. Amendment number 2 clarifies that the national or public health emergency must be based on a serious threat to health resulting from a deadly agent and makes technical changes to the termination provision. Move the amendments.
Question before the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill as to its title? Recognizing gentleman Talbot.
Thanks, Madam Speaker. I'm trying to read this bill pretty quickly, and I just had some questions for the floor leader. if
Floor
that'd be
leader?
Possible.
Yes, sir.
Good morning.
Good morning.
Thanks. The bill, the bill would, in a state of emergency, a federal and a state of emergency, the bill would confer new powers on the Secretary of Health. Is that correct?
That is correct.
So it's not, it is correct?
Yes.
I'm seeing head shake no, so I
No,
don't.
oh, I'm sorry. I'm going to turn it over to the chair of the committee.
Yield to the chair.
When there is not a state of emergency, but there continues to be a federal state of emergency, it would confer powers on the insurance commissioner that would have already been conferred were there a state emergency. How's that?
I think I've got it now. So there is not a state of emergency, and there is a federal state of emergency. The Secretary of Health would be authorized to would be authorized to use the federal state of emergency to issue emergency regulations.
To declare, now this is where I'm going to have the subcommittee chair take over.
Oh, thank you.
Subcommittee.
There we go. All right, so these are things that that the commissioner would be able to do, and they're already in statute when there is a state emergency. So they would grant periods of payment of premiums and performances of other duties by insureds, temporary postponement of cancellations, non-renewals, premium increases, policy modifications, procedures for obtaining non-elective health care services, time restrictions for fulfilling and refilling prescription drugs. You get the idea that it's regulating insurance companies during a national health emergency.
And I appreciate that, and I don't want to consume a lot of your time. And I would ask if it would be okay to special order this just for 24 hours to get a chance to look at it. And if there's an amendment, I'll make sure to get it to you. Is that okay?
That would be fine, Delegate. Thank you.
Thank you.
Question for the House is the special order HB 536 to the appropriate time tomorrow. All in favor signify by saying aye. Opposed, no. The bill has been special ordered. Clerk, read next bill.
House Bill 970, Managed Care Organizations and Health Insurance Carriers, prior authorization for HIV post-exposure prophylaxis for victims of sexual offenses, prohibition. Favorable amendments. Amendment number 1.
Recognizing subcommittee chair.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 adds sponsors and makes technical changes. Amendment number 2 removes the requirement that the prescription drug be prescribed to a victim of an alleged rape or sexual abuse, and instead provides that the provision of the bill apply only if the prescription drug is prescribed in accordance with the Centers for Disease Control and Prevention guidelines. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. For the Committee on Ways and Means, report number 4. Clerk, read first bill.
House Bill 2, Income Tax Work Opportunity Tax Credit. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical. Amendment number 2 clarifies that the credit may be claimed only with respect to wages paid during the taxable year to individuals employed in the state, alters the calculation of the credit, excludes the credit for purposes of an existing subtraction modification for wages paid to individuals with barriers to employment, and provides that a tax-exempt organization may apply the credit as a credit for payment to the comptroller of withheld wages of the organization's employees. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Recognizing the minority whip.
Thank you, Madam Speaker. I would ask that we special order this bill till the appropriate time tomorrow, if we could.
Madam Speaker.
I have to adopt, let me adopt the report. Okay. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted.
Madam Speaker?
Yes.
We would be happy to entertain a special order on this bill.
Thank you, sir.
Question before the House is to special order HB 2 to the appropriate time tomorrow. All in favor signify by saying aye. Opposed, no. The ayes have it. The bill has been special ordered. Clerk, read next bill.
House Bill 282, sales and use tax diapers exemption. Favor of the amendments. Amendment number 1.
Recognizing the chair of the committee.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
The amendment add sponsors. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is adoption of favorable report as amended. All in favor signify by saying aye.
Speaker.
Opposed, no. The ayes have it. The favorable report is adopted. Recognizing the gentleman from Baltimore County.
Thank you, Madam Speaker. Is it possible to hold this special order as well for possible member amendment?
Madam Speaker.
Chair, the committee.
If he would like to tell me when, how long he would like that.
Tomorrow, please.
That's fine, Madam Speaker.
Thank you.
Question for the House is special order HB 282 to the appropriate time tomorrow. All in favor signify by saying aye. Opposed, no. The ayes have it. Bill has been special ordered. Clerk, read next bill.
House Bill 288, sales and use tax baby products exemption. Favor of the amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendment.
So ordered.
The amendment adds sponsors. Move the amendment.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Recognizing gentleman from St. Mary's.
Thank you, Madam Speaker. I have an amendment at the desk. Amendment 653721/1.
Amendment number 1.
Should be considered reading of the amendment.
So ordered.
Thank you, Madam Speaker. So I agree with the intent of this bill. I intend to vote for it. Reducing sales tax on baby products seems to be a really good idea. I know families throughout our state could really utilize a tax break. But one of the biggest costs to families nowadays is gas prices. Just recently ran some polling. Inflation is the top concern, not only through the nation, but our own state. So a lot of people don't realize that back in 2013, General Assembly connected the gas tax to the Consumer Price Index, CPI. This is also, this amendment, if you want to look it up, it's House Bill 144. Because in the fiscal note there, it's $37.5 million tax increase that's coming down on our citizens this July 1st. With gas prices rising more than 30 cents in the last month, with what's going on abroad in the Ukraine and with Russia, I think a $37.5 million tax increase on fuel costs is too much for Maryland families. And look, I think this is a low estimate. I called the fiscal note writer of that bill. That's figured at 4.6%. Well, inflation last month was at 7.5%. The prices are going up. If we're going to cut taxes on Maryland families, I think it starts at the gas pump. I think they would really appreciate that. With that, Madam Speaker, thank you. I move the amendment.
Madam Speaker.
Gentleman.
Thank you, Madam Speaker. I stand in support of the amendment and the gentleman's reason for bringing it. We live in unprecedented times, at least in modern history. Even before Russia's aggression, we know that the supply chain is stressed. We know that inflation is at time higher than what it was in 1980, the rate with which inflation is occurring. And so I remember maybe my freshman or sophomore year in 2015 or 2016, I put a bill in basically saying we were going to put a sticker on the gas pump that shows the real dollars about how much gas cost, how much of that percentage of gas cost are the taxes that we pay. Now, the bill didn't pass, but the rationale remains that citizens should have a right to know how much government is collecting by way of taxes in relationship to the cost of goods, the cost of gas. Now, as we sit here today, we don't have to have that debate because we know that inflation is at all-time highs, and we know that what's happening in our world today demands an off-ramp. Now, unlike what we did with the minimum wage, which was we said that the Board of Public Works under unprecedented situations can halt the minimum wage increase, how we passed this bill before I came into the legislature was we said we're just going to attach it to inflation. We're going to remove the legislature's ability to have any debate or discussion of this during the interim. And so we leave it to the citizens to pay for our inability to make these decisions on the fly as needed. The good news is we stand here today with the opportunity to do two things. One, make a statement that we support our citizens by way of keeping taxes low when it matters. At a time when the legislature can act, it is the off-ramp. This amendment is the off-ramp. And then we're saying, too, that not only do we support exemptions for baby products, for different things that are very important to families on low income, families that are trying to raise children, we're also trying to say that if you interviewed and asked those same citizens why they liked this bill, they would have liked that amendment even better. And so with that amendment, you are saying to the citizens of Maryland that we're not cutting taxes indiscriminately. In fact, what we're doing is we're holding the tax revenue percentage the same that it was last year, but what we're not going to do is pass a significant tax increase during this legislative session when we have control of that decision making. I think that this amendment not only stands on its own as a bill, and I hear the legislature often say, well, we have this bill, and the bill is going to come. But what it's saying is, within context of these priorities of tax cuts that we're making, that tax cut policy package should also include holding our citizens harmless during this particular time in our country's history, in Maryland's history. I think we should admit at least some of the flaws that came when we passed this bill originally before I became a legislator, and that we did not give the legislature the ability to off-ramp at these times. And I believe, frankly, that if we did have that off-ramp, if that was put in this bill originally with CPI, that this would be the scenario where we would have said to the Board of Public Works or whatever the legislature would have created, this is the time where we would ask for the off-ramp to allow relief for the citizens. To the maker of the amendment, thank you for bringing it. I think it's the right spot to have this conversation, and I think it can easily be a bipartisan supported amendment because it speaks to the overall principle that we're trying to help citizens during these times. And thank you, Madam Speaker. I support the amendment.
Floor Leader.
Thank you, Madam Speaker. Colleagues, I urge you to resist this amendment. As the maker of the amendment mentioned, this is another bill which the Ways and Means Committee is considering, House Bill 144. This is not the time to make a decision about a different tax completely unrelated to the bill before us. This bill is about helping families deal with the financial costs of having a newborn baby. This is about very specific targeted relief. There is no relation to the motor fuel tax, and this shouldn't be part of this discussion. There is a way to have this discussion. It's with a public hearing, it's with public input, it's through the committee process. I urge you to vote against this amendment. Thank you.
The question before the
Madam Speaker.
the gentleman from Colby.
Thank you, Madam Speaker. One of the greatest economists in American history who taught at the University of Chicago said it well. He said, inflation is a tax. Inflation is a tax. And we have the highest rate of inflation since Jimmy Carter here in the United States and certainly in Maryland. And we have an opportunity with this amendment, Madam Speaker, to help working families in Maryland who may have children, some may not, but all probably use their vehicles to drive places. They're going to save a lot more if we get rid of the CPI automatic increase on gasoline that was passed a number of years ago. We have an opportunity to fix this problem right now. People are really hurting in this state from the policies passed by the Democrat Party at the national and state level. Everybody knows it. Everybody knows it. And it's important that we say it the way it is. This is a simple policy change, a common sense policy change. Common sense. We have a budget surplus, ladies and gentlemen, of what is it? $4.6 billion. We can do this. We can do this. And we should do this. And so for all those reasons, I support this common sense amendment to help working families of Maryland be able to afford to live in this state by using their vehicles and not get the shock at the pump every time they go there that the gas prices keep going up because of these kinds of policies. Thank you.
Speaker?
Gentleman from Baltimore and Hartford.
Yes, I rise to
County.
support this amendment. And I think you all will understand, just like me, the simple numbers. It was costing me a little over 2 years ago about $40 to fill my gas tank up. Now, the other day I filled it up, it costs $65. If you're a young family with a baby and you're filling up once or twice a week, that is a large sum of money that you can use to buy diapers. A matter of fact, it's much greater than this tax credit could ever be. So I support this amendment because when a family is looking to lose $50, $25 every week out of their paycheck to pay taxes, to pay extra money on fuel, not just the taxes, but the extra money, that money could go a lot further if it was staying in the grocery store, if it was feeding their families, if it was diapering their children. So yes, I do support this tax cut and this amendment because it is a major, major change from what we have been paying out of our pockets to fuel companies, so, and to the state of Maryland and to the feds. I think it's a very important amendment. I thank the gentleman for bringing it, and I think we should all support it. Thank you.
Question for the House is the adoption of the amendment. All in favor signify by saying aye. Aye. Oppose? Roll call.
Madam Speaker. Madam Speaker. To explain my vote.
Gentleman from Frederick.
Thank you, Madam Speaker. Just to explain my vote, this might be the only time on the House floor we have a chance to vote on this, hopefully not, but it probably will be. So anybody who's voting no right now is voting for a tax increase. This is not trying to
Are you explaining your vote? You
Yes, ma'am.
mentioned anybody. Your vote, you got to explain.
So my vote that was a no needs to be a yes so that I don't have a tax increase. Thank you.
Thank you, ma'am.
Gentleman from Anne Arundel to explain his vote.
Thank you,
in
Madam
front.
Speaker. Colleagues, it was Ben Franklin that said, don't put off until tomorrow what you can do today. And I voted for this amendment. This is a very smart amendment that brings relief immediately. And I know that we're doing this for baby products, but I promise you, if you were to poll any mother or father right now, would you rather we cut your price of gas or diapers? I'm pretty sure they're going to say gas because that's where it hurts the most. All of these parents are putting their kids into their car and driving around and paying twice as much today than they were a year ago. That hurts. Sometimes you can't decide not to buy gas. You'll have to do it in order to meet your kids' needs or meet your family's needs. And unfortunately, we just lost the opportunity to provide relief to millions of Marylanders because we want to kick it down the road for this promise that we'll fix it tomorrow, which rarely happens. Thank you, Madam Speaker.
The gentleman from Anne Arundel.
Thank you, Madam Speaker. Body, I think there's a lot more impact of the CPI being tied at the gas pump. It's felt in the grocery store, the price of milk and eggs and all necessities that people of low income or seniors are experiencing. So the increase is not just at the gas pump, it's actually going to every single necessity that we need in our household. So I hope, I'm voting green on this bill because I think it's a good tax relief, but I hope many of you would reconsider your vote. Thank you, Madam Speaker.
Recognizing the gentlelady from Carroll.
Thank you, Madam Speaker. I rise this, I'm explaining my vote. This bill, we haven't really said exactly what it is, but the bill is about baby bottles and bottle nipples and car seats. Not about diapers, but baby bottles, nipples, and car seats to exempt them from the sales tax. And while that's nice, it's a $2.5 million hit to the budget, which is like a very, very teeny little amount. I don't think it's going to affect anyone's life very substantially. I have two new grandchildren. I can tell you the maybe $2 that they save on these bottles and nipples is not going to really change their life. But the sales tax on gas right now that's going up because the price of gas is going up, and the sales tax on that accordingly is going to affect my children and grandkids' lives because filling up a tank is very expensive. This is probably the only time we're going to get it to vote on this to relieve us on the sales tax on gasoline, which will affect our children, our grandchildren, much more than baby bottles and nipples and taxes on sales tax on car seats, the couple dollars that might be saved over that. So that's why I'm putting my vote up right now, green, on relieving us from the sales tax on gasoline. Thank you.
Gentleman from Talbot.
Speaker, I just want to explain my vote. You know, I'm voting for this amendment. You know, the government is driving the price, and the people are having to pay the price, and this is our chance. I see it as a chance to provide some relief. I can't tell you how many gas pumps I've come to where there's a picture of the president saying, "I just did that." It's our chance. This is our chance to send a message to the people that we're aware of what's going on, and to send an answer to what President Biden's doing. Thank you.
Clerk will take the call. The amendment fails. Clerk will read the next. Oh, HP 288. What am I doing now? Are there any additional amendments to the bill to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read the next bill.
House Bill 364, Sales and Use Tax, Medical Devices Exemption. Favorable amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much be considered the reading of the amendments.
So ordered.
Amendment number 1 is technical and adds sponsors. Amendment number 2 exempts the sale of certain face masks from sales and use tax. Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk will read next bill.
House Bill 383, Young Readers Programs, Establishment Young Readers Program Expansion Act. Favorable amendments. Amendment number 1.
Recognizing the committee, subcommittee chair.
Thank you, Madam Speaker. So much be considered the reading of the amendments.
So ordered.
Thank you. The bill amendment number 1 is technical. Amendment number 2 allows any early reader organization eligible for participation in the Baltimore City Young Readers Program or the Young Readers Matching Grant Program, allows nonprofits or any instrumentalities of state, local, or municipal government to apply for the matching grants rather than just counties, and lowers the specified appropriation of the grant to $250,000. Move the committee amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. Question now is adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. Clerk, read next bill.
House Bill 492, Sales and Use Tax, Oral Hygiene Products Exemption. Favor the amendments. Amendment number 1.
Madam Speaker.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much to be considered the reading of the amendments.
So ordered.
The amendment adds sponsors. Move the amendments.
Question for the House is adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted.
Madam
Question now is the adoption of favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. The favorable report is adopted. Gentleman from Anne Arundel.
Thank you, Madam Speaker. Would it be possible to special order this bill?
Recognizing the floor leader.
Thank you, Madam Speaker. Yeah, we're happy to entertain a special order.
Thank you. I appreciate it. Thank
Question
you,
for the House is Special Order HB 492 to the appropriate time tomorrow. All in favor signify by saying aye. Opposed, no. The ayes have it. The bill has been special ordered. Clerk, read next bill.
House Bill 1151, Sales and Use Tax, Diabetic Care Products Exemption. Favor the amendments. Amendment number 1.
Recognizing the floor leader.
Thank you, Madam Speaker. Move so much to be considered the reading of the amendments.
So ordered.
Amendment is technical, adding sponsors.
Move the amendments.
Move the amendments.
Question for the House is the adoption of the amendments. All in favor signify by saying aye. Opposed, no. The ayes have it. The amendments are adopted. The question now is the adoption of the favorable report as amended. All in favor signify by saying aye. Opposed, no. The ayes have it. Favorable report is adopted. Are there any additional amendments to the bill or to its title? Hearing none, the bill is ordered printed for third reading. That ends the work at the desk. Committee announcements. Appropriations.
Thank you, Madam Speaker. The full committee will meet today to continue public bill hearings at 1 p.m.
Judiciary.
Thank you very much, Madam Speaker. Ladies and gentlemen of the House, the House Judiciary Committee will be having bill hearings starting at 1 o'clock today.
Environment and Transportation.
Thank you, Madam Speaker. The Environment and Transportation Committee will continue public hearings at 1 p.m.
Ways and Means.
Thank you, Madam Speaker. The Ways and Means Committee will continue public bill hearings at 1 p.m.
Economic Matters.
Thank you, Madam Speaker. Economic Matters will continue hearings at 1 p.m.
Health and Government Operations.
Thank you, Madam Speaker. That committee will continue its public hearings today at 1:30 p.m.
And the caucus announcements. Okay. Calling on the Protocol Committee Chair.
Thank you, Madam Speaker. Colleagues, I come before you today to let you know that our pages have been around all session, and they have been watching you and watching us and everything that we have done. So this is their second go around this time, and I would like to take a moment to introduce those who are watching us today. And if you would, in your fashion, when you hear your page from your county, let them know that you appreciate them being here. So we're going to start with Chloe Byrd from Frederick County, District 4, Linganore High School. We have Rhea Del Campo from Prince George's County, District 22, Parkdale High School. Eliza Ferrer from Anne Arundel County, District 33, Broadneck High School. Aurora Mahoney from Allegheny County, District 1B, Bishop Walsh High School. Aiden McPhillips is here from Calvert County, District 27C, Huntington High School. We have Lydette Moges from Anne Arundel County, District 32, Meade Senior High School. Liliana Norcatus from Harford County, District 7, and Falston High School. We have Lauren Raskin from Montgomery County, District 14, Poolsville High School. Christian Thomas is here from Montgomery County, District 6, Eastern Technical High School. Baltimore County, sorry. And then we have Cameron White from Anne Arundel County, District 33, Bishop Spalding High School. Colleagues, make sure that you try to reach out to them, and when they contact your offices, as I have encouraged them to do, make sure that you show them some love. Thank you very much, Madam Chair. Madam Speaker.
Thank you. Quorum call before adjournment.
Madam Speaker?
Madam Speaker,
Gentleman, Baltimore County.
could I have a point of privilege, please?
Gentlemen, go ahead.
Thank you. I just want to make it perfectly clear, when I was praying for wisdom for the leaders of Russia. I also want to pray for peace around Ukraine and put a protective hedge before I was stopped. And I want to make sure that I didn't offend anyone here. And I just want to make that perfectly clear. Believe me, I know what's happening in this world. We do need to pray for this world. Thank you.
Thank you. Clerk will take the call. There being 133 members present, the House is still in session, recognizing the Majority Leader.
Thank you, Madam Speaker. I move that the House stand adjourned until Wednesday, March 2nd at 10 a.m., Legislative Day, February 26th, for a regular session.
As we will be having our photo, please clear off the tops of your